The National Health Mission and UNICEF today organized a half-day media sensitization workshop on COVID-19 vaccination drive at State Convention Center in Shillong. The aim of this workshop is to sensitize media persons on the vaccine. Many incidences have occurred due to lack of awareness among the public, and the role of media can be utilized as a powerful tool to combat rumors. The State Health Department will officially launch the COVID-19 vaccination drive on the 16th of this month on a phase-wise manner across the state. In this regard, the COVID-19 vaccine has been developed to help tackle the COVID-19 pandemic by protecting and preventing the disease from spreading further. Present at the workshop was Shri P. Sampat Kumar, Principal Secretary, Health and Family Welfare Department, Meghalaya, along with Joint Director, MCH and FW, cum Joint Mission Director, NHM, Dr. P. Manners, State Immunization Officer, Dr. N. Roy, SMO, WHO, and representatives from UNICEF and media persons from different media houses.
Why taking the measures for containing this pandemic? Government of India also has actually invested in actually finding, a solution through, vaccination programs, especially, investing in how actually we can, produce a vaccine that can prevent and contain this, this particular disease, which doesn't have, basically essentially it's very infectious and doesn't have a kind of a solution, except that we are dealing with isolation and some kind of a emergency critical care. So based on that, the government of India has come up with two vaccines have been authorized. I think you all aware the two vaccines. One is Covishield and another is Covaxin, and these two vaccines are being distributed across the country. And we, Meghalaya, in the state of Meghalaya, we have got the Covishield in the first phase, 35,000 doses. And these 35,000 doses also are going to be distributed, in fact, in a manner that very systematically. In the first phase, we are covering the healthcare workers. That healthcare workers means healthcare workers both in the private sector and also the public sector. So we have about 27,000 healthcare workers are there within the state government domain, and then we also after the first phase we'll be extending this vaccination drive to the frontline workers. Frontline workers includes the police and the municipal workers and and the disaster management people. So this is again the other second phase, and the third phase is for those above 50 years and those with comorbid conditions, because for them it is all the more important. So that's why the third phase is that. So this is the kind of a plan that has been put in across the country, not only Meghalaya. So that is the way actually we are going to do this. But now today's meeting is essentially about talking about how this entire vaccination program is going to be rolled out, and why. First, maybe we can actually have a discussion. Especially this is a workshop for making people to understand, to bring awareness and also to bring that acceptance and to bring that entire mobilization. This is a very important thing. So one of the things you are aware, why actually we do give vaccinations. Let us start with the fundamental starting point. If you look at it, see, Meghalaya, we in fact last year we have achieved the vaccination program that actually we conduct for the children, because that's a very important thing. Many of the children die because because of many diseases which do not have a cure. So vaccination is essentially something that, for example, polio. So polio we have eradicated. At least in Meghalaya there is no polio. So the vaccination program is that way it is so important for the people to prevent from those diseases, especially which do not have a cure. So last year we had very good experience of actually vaccination program. In fact, Meghalaya was actually lagging behind in the full immunization of children, at some point of time for various reasons. Then actually we started bringing that awareness among the people about the need for the immunization, need for the vaccination. So today actually we are one of the top performers in the country in terms of the full immunization coverage of the children below 1 year.